Sometimes I feel like telling a patient straight to her face, "You came too late," or that this wrinkle really isn't your biggest problem. But I don't say it because it would sound too harsh during the appointment. In this video, as an aesthetic medicine doctor, I'll give you the advice you might hear if your doctor wasn't afraid of hurting your feelings. First piece of advice: the treatments you've had so far have been ineffective. There are a few product names that, when I hear someone has used them on you before, promising huge changes and transformations, I just can't believe it. Which specific products am I talking about? I can't say, because it would probably end up in court, and I don't want that. But I'll tell you one thing. You often choose a cheaper procedure because you don't want to stretch your budget, or you opt for a less invasive treatment because you're only looking for natural results. Both of these choices are completely understandable, but there's no point in doing treatments that simply can't work. How do you avoid doing such pointless treatments? Start by saving this video for later, because I list specific examples there of what simply can't work. The second piece of advice is even harder for you to accept. And the second piece of advice: you came to the clinic too late. The best example I can compare aesthetic medicine to is dentistry. Imagine this situation. You're 50 years old and you've never been to the dentist. You've lost half your teeth. Some of the ones you have left are decayed, and your molar keeps hurting all the time. And then you think to yourself, I need to go to the dentist. So you go to the dentist and say that you'd like, in one or a few visits, to have all your teeth back and a smile like you had 20 years ago. Sounds strange, doesn't it? It makes sense to you that you need to take care of your teeth both at home and by having regular checkups at the dentist. If you agree with that, I encourage you to look at your skin the same way. Aesthetic medicine, the good kind of aesthetic medicine, should be support for you from a professional, a doctor, or a cosmetologist in taking care of your skin over the long term. In other words, it should be about prevention, not fixing what has already been damaged, because it's simply easier to take care of what's good than to repair ruins. By saying all this, I want to emphasize that there is no wrong time, age, or circumstance to go for your first visit to an aesthetic medicine clinic. In every case, I am able to help in some way, but the truth is that you will experience the greatest long-term benefits if you don't start too late. You know what else you're starting too late? Seriously thinking about smart skincare. And that brings me to the brutal piece of advice number 3, which I would give you if I wasn't afraid of hurting your feelings. Advice number 3. Your skin is not being properly cared for. I've met hundreds of women who believed they had a well-thought-out home skincare routine. But after I asked for specifics, it turned out their home skincare was actually pretty poor. The most common mistakes? You use a product recommended by a friend because it worked for her. You buy products on sale because you think more expensive means better. You don't use SPF filters every day. You change your skincare products as often as you change gloves. You use weak products that only look cool. You confuse convenience of use with quality of results. You skip important ingredients because they irritated your skin. In my career as an aesthetic medicine doctor, I have even encountered cases of people, women, who have never used any skincare products on their face except for soap. And if I happen to meet a woman over 50 in my office who was considering tissue stimulators, but whose skin had no idea what a face cream was, then we have a problem. Remember, it's not the treatments in the clinic, but the small things you do every day that make all the difference. If I had to choose between having dozens of treatments in my life or having a great daily skincare routine, I would definitely choose the latter. That's why you should go for a consultation, preferably with a cosmetologist or an aesthetic medicine doctor who takes a holistic approach, someone who will ask you about your skincare products and give you good advice. And if those options aren't possible, I've prepared something special for you. I wrote the book Understanding Cosmetics with the mission of gathering everything you need to know about smart skincare in one place. You'll find recommendations for over 140 cosmetics, face creams, and serums for every budget. This book will pay for itself right away because you'll finally stop buying cosmetics that don't work. And now, let's move on to the next tip, whose honesty will definitely surprise you. Tip number 4. Fixing just that one problem you came with won't make much of a visual difference because there are many others. This tip is the most complicated to explain, but stay with me because it's really important. As a doctor in my office, I conduct long and thorough consultations. I ask questions about everything that affects skin quality, but at the same time, I don't want to and can't impose my opinions on the patient. I always start as the one who asks questions and listens carefully. Among other things, I ask what you pay the most attention to in your appearance. I ask about this so I can focus on the issue that might be bothering the patient the most at the moment. And now, to the point. Very often, what the patient comes to the office for is not, in my opinion, the most important thing for improving skin quality and maintaining a youthful appearance here and now. An example? The patient has a dull, sallow complexion full of discolorations, but what she focuses on the most is her double chin, which I don't even notice because it simply isn't there. Over the years of my work, I have learned how to find my place in such a way that I am always a partner in action for the patient, not a doctor who barges in with bad news and pushes their own ideas. But you need to know one thing. Skin aging occurs on many levels at the same time. So we look older than we did 5 years ago, not for just one reason, but for several reasons at once. And it's definitely not just about having more wrinkles now than we used to have. When taking care of your skin's quality, you need to pay attention to discoloration, skin firmness, facial sagging, broken capillaries, pores, loss of hydration, skin tone, loss of volume, and several other factors. Why am I mentioning this? Because often, as patients, we fixate on one objectively insignificant thing, which unnecessarily becomes our complex. That's why it's entirely possible that fixing this one issue you came in with won't make much of a visual difference. And that brings me to the next piece of advice, which I can say directly here, but in the office I have to be very careful. Fifth tip: your lifestyle will undo all the treatments. I've noticed that most of us think we have a healthy lifestyle, but the truth is completely different. Most often, we compare ourselves to those around us, and if we come out better in that comparison, we give ourselves a medal. However, the truth is completely different. I told you earlier that my consultations in the office are very thorough. I always ask, among other things, whether you experience a lot of stress in your life. In 9 out of 10 cases, I get an affirmative answer. Then I ask about sleep and I hear too little. And later I ask about hydration and I hear I drink too little water. From time to time, I also hear confessions related to risky alcohol consumption and smoking cigarettes. The paradox is that we all know perfectly well that what I just listed is harmful to our health. But for various reasons, we do it anyway, and then we go for a treatment at the clinic, expecting it to fix years of our neglect. In my opinion, it's worth flipping this pyramid and starting to think about the foundations first, and only then about treatments like Botox or tissue stimulators, which, in my understanding of skincare, should be an addition, not a fixer for our life choices. However, I won't leave you empty-handed. I believe that in trying to pursue a healthy lifestyle, we've fallen victim to Instagram reels, clickbait headlines, and all sorts of life hacks that are supposed to instantly change our lives. If you subconsciously feel, and have already experienced firsthand, that there are no tricks for complicated problems, and you understand the difference that something can be simple but not necessarily easy, then I invite you to watch my video, the thumbnail of which is now displayed on the screen. In it, you'll find out exactly what to do to live a healthy and long life, and you'll finally stop chasing trends that have disappointed you so many times before. And if what I said in today's video was valuable to you, please leave me a comment to help with reach. I'll see you in the next video. Thanks for watching. Kisses. Bye.